Welcome back to this course on ACL injury rehabilitation. The week 7 return to sport and sport specific conditioning. Lecture 35 Interdisciplinary coordination, role of coaches, trainers and therapists in return to play. I am Dr. Jerrin Shaji from the Department of Sports Medicine AFMC Pune. In this lecture, we will be discussing how teamwork can be utilized for correct decision making. By the end of this lecture, you will be able to understand the importance of multidisciplinary teams in return to play, recognize the distinct roles of medical, rehabilitation, performance and coaching staff, apply effective communication strategies for athlete management, and review an elite athlete's RTP journey. We will be covering the lecture under the following scheme: why multidisciplinary teams matter in return to play, the roles of an RTP team consisting of a team physician, physical therapist, strength and conditioning coach, sports psychologist, and technical coach, various communication strategies for the team, and a case study of elite athlete RTP team model. Now let's see what is RTS versus RTP. We have heard these terms quite often and may even use this interchangeably, but how is it different? The RTS or return to sports is the resumption of participation in sport at some level, which may include training, practice, or competition. The focus here is on engaging in the chosen sport after rehabilitation, regardless of whether it matches their exact pre-injury competition level or not. RTS may be achieved when the athlete is physically and psychologically ready to participate, but not necessarily to perform at their previous intensity or skill level. Whereas return to play or RTP is a specific subset of RTS that refers to formal medical clearance for an athlete to re-enter competitive play, often at their pre-injury level or higher. The RTP involves meeting objective, functional, physical and psychological criteria and being cleared by the medical and rehabilitation team to safely rejoin matches or official competitions. Let's see the role of multidisciplinary teams in the process of return to play. ACL rehabilitation involves physical, psychological, tactical and medical clearance. Statistics show that athletes with coordinated RTP teams show lower re-injury risk and faster return to sport. The benefits of such a multidisciplinary team is that integrated decision-making process ensures safer clearance, reduced silo effect, that is conflicting advice from different specialists thinking in silos, a holistic athlete management, that is medical, performance, mental and tactical readiness. Let's see the roles of various personnel in the RTP team. The team physician. The team physician gives the final medical clearance. He or she also oversees the healing status of the graft integrity, and various secondary injury prevention measures. The team physician also conducts the final clearance by utilizing various imaging or investigation modalities, objective screening or functional tests, and health checkups. Coming to the physical therapist. The role is to provide functional restoration, and the focus of a physical therapist is on regaining range of motion, strength, and neuromuscular control. The physical therapist designs phase-based rehabilitation program and return to movement testing is undertaken. Coming to strength and conditioning coach, whose responsibility is to ensure sports readiness. This can be done by building in a phased manner the strength, power, and agility. Also, the coach monitors external loads using GPS, jump, and sprint tests. This person also integrates periodization in the rehabilitation schedule. Now coming to the sports psychologist. The role of a sports psychologist is to ensure mental readiness by addressing fear of re-injury, various motivational issues, and confidence issues. They can utilize various tools like ACL RSI scale, imagery or visualization techniques, and coping strategies. Now coming to the technical coach. The role is to integrate various tactical and sport specific movements. The coach reintroduces the athlete into tactical play and decision making. He or she also provides sport specific feedback and controlled reintegration to the team training. The slide again apprises you on the roles by each members of the RTP team. To recap, the coach ensures tactical play, decision making, and team training. The team physician ensures healing status of the graft integrity, and regular health checkups. The physical therapist ensures improvement in range of motion and strength, as well as enhanced neuromuscular control. The strength training coach helps rebuilding strength, power, and agility. The sports psychologist removes fear of re-injury and ensures sufficient motivation and confidence of the athlete. Like any team, the RTP team also should ensure effective communication strategies. These can be done by various shared data platforms for monitoring the athlete health and training load, periodic team meetings aligning the goals across the medical and the coaching staff. This can be done at least once weekly. The RTP protocols can be made as standard milestones for achieving various targets utilizing various functional tests and screening tools. Also, athlete-centered communication among the team members is most important by involving the athlete himself or herself in the goal setting and the progression process. Let's see a case study of an elite athlete RTP model. A professional soccer player 9 months post ACL reconstruction. The physician's role is to clear that the graft healing has taken place adequately using clinical tests and imaging if required. He finds that the hope symmetry or limb symmetry index is more than 90%. The physical therapist confirms that functional readiness has been achieved and there are no abnormal movement patterns. The strength and conditioning coach has built sufficient acceleration and deceleration loads and found that it matches the competition demands. The sports psychologist has addressed various hesitations in contract drills and used graded exposure and confidence training in the athlete. And the technical coach has reintegrated in the controlled team drills with full contact training and competitive simulation sessions and brought back the athlete to competitive levels. The outcome of such a team effort is that the athlete has returned to sport at 11 months post ACL reconstruction and remains re-injury free for 2 years follow-up. Let's quickly go through an injured athlete's return to play journey. The initially healing graft with functional readiness, strength building, psychological readiness, team integration, and finally competitive match can successfully bring the athlete back to sports and ensuring victory for himself and for his team. So the take-home messages from this lecture are: ACL return to play requires an interdisciplinary team approach consisting of various stakeholders. The role of each person contributes to a unique layer of readiness for the injured athlete. Communication and shared data are central to decision making for the team. And remember, collaboration is safer and ensures a more effective return to play for the athlete. These are my references. Thank you very much and have a great day. Jai Hind.